Welcome to the show, everybody. This is Pick Dr. Osborne's Brain, where you get to ask your questions about nutrition, diet, lifestyle, autoimmunity, and I give you my best answers. This is not medical advice. This is for educational purposes, but I hope you learned something today that you can take away and really improve your health with. So if you missed Tuesday's show, we talked about the 6 primary vitamin and mineral thieves. It's a great show. You should go back and check it out. Super comprehensive on what causes vitamin and mineral deficiencies, and it goes into the depths and the details of that. You can also get the show notes from that show, and if you want those notes and didn't get them yet, make sure you just type in the comments below, type in vitamins, and I'll make sure that you get those notes from the show. So let's dive into your questions. Why would a provider use a free T3 index rather than a direct free T3 test to measure free T3 in the blood? Boy, that's a big one to open up with. It's provider dependent. I can't speak for what other providers are thinking or doing, but to me, when you're using indexes, when you're using ratios, it's less accurate. What we want is we want direct, objective information that we can draw from and not have to draw it and make different types of conclusions. The less we have to speculate when we're doing lab tests, the better off you're going to be, and the more accurate we're going to be. So I would always rather know what is your direct free T3 quantity than what is your index. At any rate, I don't know if that answers your question, but direct versus indirect, direct versus ratios, always better in that regard. Do you have any tips or suggestions for someone hopelessly addicted to grains and sugar? Well, there's never such anything as hopelessly addicted. The premise of your question indicates you have hope. So hope is step one, right? But if you're highly addicted, the first thing I would recommend that you do is share your goals or your plans with a partner who will keep you accountable. Declare it. In essence, declare what you're trying to do. So if you're trying to stop gluten or sugar, declare it, right? Share it, declare it. Because when you do that, you now have somebody advocating for you. That's a big step in the process, because if you've got a good friend or husband, wife, whoever your partner would be that advocates for you, if they love you, they're going to hold you more accountable. And that always is helpful. Having the support around you, probably one of the most effective ways to overcome any kind of addiction. Now, beyond that, consider using theanine, vitamin C, vitamin B3. Now, these 3 are just generic tips, right? So these 3 are known to help people that have addiction. Now, from that perspective, there are many other things that you could also use, but I would start here. Dosing would be theanine, 200 to 400 milligrams a day. For vitamin C would be anywhere between 1,000 and 10,000 a day, depending on bowel tolerance. And vitamin B3, depending 100 to 300 milligrams a day. You got to watch out for B3, though. It causes a flush, and it can make your skin hot and itchy. And some people get nervous by that, but at these doses, it's going to do that. But all 3 have been studied in a human addiction research to be effective at helping reduce addiction or improve people who are trying to overcome addiction. Now, beyond that, I would say you got to get tested. Because what I have seen, especially as it relates to sugar, so that was the other thing I think you'd mentioned. So like one of the things that will cause sugar addiction, and it will be relentless, is B vitamin and chromium deficiency. Chromium its nickname is the glucose tolerance factor. But with B vitamin and chromium deficiency, you're going to crave sugar. And this has to do with biochemistry of craving more than anything else. So you could take a B complex and you could take a chromium, but you could also test these things. And in my experience, there are also other things like magnesium deficiency will cause someone to crave sugar. We see other nutrients like lipoic acid playing a role, inositol playing a role in sugar craving. So there's a lot of potential biochemical mechanisms there that could drive your craving, that no matter what your willpower, no matter what your accountability partner is telling you, your brain is going to override your common sense and good judgment. So always, if you're really, really struggling, test first. Test, don't guess. And then there's another thing that I'll just mention with these cravings, and that is oftentimes people have yeast overgrowth in their GI tract. When you have a yeast overgrowth in your GI tract, yeast is going to send a message to your brain, and it's going to tell your brain to tell you to consume high carbohydrate, gluten, and sugar-based foods because these guys want to be fed. And so sometimes what has to happen is you've got to wipe out a yeast overgrowth. Now, there are certain things that you can do to help with that. There's, let's make some space here. Caprylic acid can be antifungal, sometimes very helpful in this regard. A good probiotic, a good strong probiotic. We have something called Ultrabiotic Defense that I recommend. And then we also have an herbal formula. There are a number of different herbs that have antifungal properties, but the one I'm partial to is the one I designed. It's called Yeast Shield. And that can sometimes be very helpful at kind of helping balance the microbiome if there is, yeast at play. So consider these three things if there's yeast. Consider testing to understand more your nutrient status as it relates to how you might biochemically crave something. Just as low-hanging fruit, consider these three nutrients because they've been pretty decently studied in human addiction research information. So hopefully that gives you a nice rounded place where you can start and dive in and get gluten and sugar free. What are your thoughts on humic acid and fulvic acid for gut healing versus prebiotics? I assume, I don't know if that's a typo, prebiotics. Okay, I think humic acid and fulvic acid predominantly are just going to be good sources of mineral content. But as far as like gut healing, they're not the top of my list of things that I think everybody needs for sure. For gut healing, it depends on what's doing the damage to your gut, right? Your body knows how to heal. And so supplement input is sometimes overemphasized as the solution, when in reality, what you really need to do is understand why your gut is damaged. If it's the wrong food that you're eating, if it's chemicals, additives, preservatives, or dyes that you're consuming, is the microbiome imbalanced? So like, for example, fulvic acid would be fine if you were deficient in minerals and that was leading to some gut inhibition. It would be a good thing to do. But if you had just gotten off of an antibiotic and your microbiome was wiped out, then a probiotic would be a better choice. So it's also case dependent, Kalapi. So there's no one size fits all in this regard. Scroll down in the middle or in the left, right there. After eye surgery, diagnosed with bilateral temporal arthritis or giant cell arteritis, doctor put me on high. What happened? Doctor put me on high dose of prednisone. Basically, doesn't feel great at all. Blood tests don't look great. What can I do? We have an article on arthritis, I think, at Gluten Free Society. Maybe we can post that up as a link here. Give you at least some kind of a resource in that regard. But it's an autoimmune condition. You really, in my opinion, go gluten-free first and foremost. Get you a copy of No Grain, No Pain if you haven't already. And start following the diet protocol there. You can get a copy at your library. You can get it at Amazon or any other major bookstore. start that diet for 30 days and see what that does to your, to your arthritis. Surgery, whether the surgery induced it or partly induced it, it's probably was the tip of the iceberg for you. It was the stress that proverbially broke the camel's back, so to speak. Based on comment in Tuesday's video, why does the body increase cholesterol in certain situations, and what are those circumstances? Need. I mean, cholesterol is a carrier of nutrients. Cholesterol helps to heal and repair inflammation. Cholesterol is a precursor to hormones. So it depends on the individual's needs. There are a lot of different things. Exercise can increase cholesterol. Stress can increase cholesterol. So there's not one answer to that question. There's a lot of potentials that could be going on. And this is another reason why I'm not a fan of, taking one cholesterol reading and damning somebody to statin medications for the rest of their life, just as a certain, this is the right thing to do. I think it's a mistake. Dr. Osborne, have you ever turned patients away because you're overqualified to treat the problem, i.e. low back pain? We don't turn people away, Dennis. Some cases are easier and some cases are more challenging, but nobody gets turned away. The only people really, they turn themselves away. What I would say is they feel like I'm not a right fit for them, or they feel like after talking with me that what I'm going to ask them to do isn't something that they're capable of doing. But in my clinic, Dr. Driscoll, myself, we don't turn people away. People generally, when they're asking for help, it's what we do. Dr. O, I've taken a few of your INA tests over the last few years, and I'm generally always surprised with the number of borderline and deficiencies in each test, considering how diligent I am with my lifestyle and minimal symptoms. It's your stress level, Jessica. I can pinpoint that exactly. So your question is, though, do I have on my own tests borderline or deficiencies? Yeah, I do. I don't have quite as many. Generally, it's pretty tight on mine, but I'm so dialed in that regard. Where I see it fluctuate, Jessica, is when I'm going through rough patches in life. Like when we lost our house to mold a number of years ago, my INA was on the floor. But afterwards, it took several years after mold to kind of recover health. But afterwards, it's pretty dialed in. Before that, it was pretty dialed in. Now, when I lost my son a number of years ago, it hit the floor, right? So for me, I've been doing this for 25 years. So on myself, it's usually pretty dialed in. And the things that I can't control are the things that usually create the biggest deficits as a general rule of thumb. Okay. Okay, so Lynn says, I took the food sensitivity test and I don't understand the result about the Candida screen. What is that about? I have a high IgA and IgG. That's a bonus ad that we added to the test, Lynn. It's not a food, but if you have IgA, IgG positivity to Candida, in this case specifically, it's Candida albicans. What that means is that your immune system is currently producing active antibodies against this microorganism, most likely because you have an overgrowth of this microorganism. And that overgrowth could be in your gut, it could be in your bloodstream, it could be vaginally, it could be really in any tissue of your body. So the fact that that's flagging positive, you would want to embark upon some strategies to basically balance this back out. Now, I've done entire shows on the topic of Candida and how to balance Candida. What I'll do is Mel, if we could post a link to one of our shows on Candida for Lynn on Facebook. Would taking creatine do anything for a 75-year-old woman? Yeah. Partly depending on, as you're taking it, what you're taking it to do or try to accomplish. So Lynn, if you're trying to accomplish muscle growth, lean mass, you're gonna accomplish that if you take creatine. Now, if you take creatine and you don't exercise, you're probably not going to accomplish much. But if you're trying to do increased muscle, you need 5 grams a day, kind of as a starting place. And if you're trying to improve cognitive function, brain power, you can go from 10 to 25 grams a day. It's going to be more effective because creatine has a hard time getting past the blood-brain barrier, so you got to really go higher doses to affect cognitive function. So part of it just depends on what you're after. 5 grams a day if you're just trying to exercise and build lean muscle mass and maintain good muscle as you age, and reap the benefits of that, is a good place to start. Hopefully that helps you. I have a whole crash course, Lynn, on creatine that you should probably check out. But if you're not going to exercise, the only benefit is on the brain and the cognition, as far as we know. There may be some other benefits, but as far as we know. But I would strongly consider you exercise. You should consider the exercise part. You'll get double the benefit out of your creatine. Let's see. If glycine low dose 500 milligrams is causing mild Herx-like reaction, mild headaches, fatigue, gas, and digestion, does that usually mean there's a problem with eliminating toxins? Usually means you've got, usually clinically, this is not always the case, but most of the time, Melissa, it's, if you're reacting to glycine and it's a Herx-like response, then your body is either very low in glycine, meaning you've had deficiency for a while and your detox bucket's gotten full. Partly because glycine is a key ingredient to making glutathione. Glutathione is how your body filters your blood and takes out the trash, so to speak, or what people refer to as detox. Now, if your glycine levels are low, what happens to your detox is it also suffers. And so if we think of detox as a simple analogy as like a bucket, and in the bucket are all the chemicals, toxins, and other things you're exposed to on a daily basis. If that bucket starts to get full and it starts to spill over, these are symptoms. Herxheimer response, detox reaction. So a lot of times when people take a supplement like glycine or glutathione, sometimes even N-acetylcysteine, they become symptomatic because they accelerate detoxification, and that creates a Herxheimer type response. So either you have kind of a historical overload or overburden, or you have, so again, this could be historical, meaning you've built it up over the years and you've been deficient long enough that your body has just kind of shoved all this stuff into your fat cells. And when you start taking glycine, it starts mobilizing out and you start becoming symptomatic. Or you have an ongoing current exposure that is creating these symptoms as well. And so an example of that might be that you're gluten sensitive and you're eating gluten, or as we mentioned earlier, you have a Candida overgrowth, or you have mold in your environment and didn't realize it, or you're eating non-organic foods that are loaded with glyphosate, and that glyphosate is an ongoing current exposure. I mean, there's 1,000 potential answers I could give you there, but that's, if that's what's happening to you, that's most likely the case. I'd get more detailed testing done. If you work with a good functional doc, you can get a lot more clarity on that. I took INA and I came back deficient in lithium. So how should I take it? You can, if you're using our product, Lynn, the Ultra Lithium product, you could start with just 1 capsule a day. Therapeutically, I sometimes start people at 2 of those capsules a day, but that's when I have a full knowledge about their background and everything else. But 1 to 2 capsules a day is generally a pretty safe place to start with supporting your body on that lithium deficit. If you don't take any medication, then there's really not any contraindication to worry about. And even if you were taking medicine, there's very little contraindication at all to lithium. Lithium is a very safe supplement, and it got its reputation from the psychiatry world, where they're using doses much higher than nutritional lithium. They're using very, very high doses of lithium to treat things like both bipolar disease. And there are some contraindications when you get the dose, 90x higher than what you're going to get in a supplement. But that supplemental dose, you should be perfectly fine without any kind of fears. Purchase your Ultra Choline. You mentioned in your videos, the eggs and meat are good for holiness, but your supplement is plant-based. Can you please tell us it's 100% bioavailable. So choline source is not really affecting its bioavailability. Choline citrate has an extremely high bioavailability. The reason we plant source our choline isn't because plant sources are better than meat sources or that meat sources are better than plant sources. Choline, at the end of the day, whether it's coming from a plant or an animal, is going to be recognized by your body. But we use a plant source. A big reason why we use a plant source is we understand that there are many people that are vegetarian and they want an option to get choline, and they don't want to eat meat or meat-based foods because either they have a religion or they have some type of conscientious objection to that. And so we're just trying to support this population with, ours is actually a cruciferous design. So it's designed, or it's extracted from cruciferous vegetable. But in this way, people that are following vegetarian diet can use our choline product and not worry about compromising their beliefs. Which nutrient can fix hypothyroidism in the gut? There's not a nutrient that fixes either one. There are nutrients that can support your body's ability for your thyroid to function naturally. For example, vitamin D, selenium, iodine, omega-3, vitamin A, vitamin B are all important for how your thyroid hormone is produced and regulated. And so any one of those deficiencies could create a problem with your body's inability to make adequate thyroid hormone. That being said, it's not one nutrient. You should go back and check out our thyroid crash course. We have one on, it's all about the nutrition related to the thyroid. And the same is true of the gut, because that was part 2 of your question. There's not a nutrient that fixes the gut. The gut doesn't get fixed by supplements. You can support the gut with supplements, but ultimately, why is the gut broken? And that has to be reverse engineered. Because if you're not determining that, you're just going to be on a supplement train, bouncing from one thing to the next to the next. I'm about to start my thiamine protocol because it's pretty obvious I must be deficient. I'm in my mid-30s and started drinking heavily, but only weekly back when I was 17. So this may be more of a comment. Well, let us come back and let us know how you do when you started. How does it change? How does it change the nature of how you feel, and how does that thiamine work for you? Which nutrients do beta blockers deplete? Predominantly CoQ10 and zinc. After COVID in 2021, my ferritin levels dropped significantly and hair loss followed. Despite iron supplements, ferritin has not risen. Please help. If your ferritin is still low, part of it depends on how much iron you're taking. Part of it also depends on whether or not you have blood loss. So let's just kind of give you a little map out to think about here. So there's iron, and then there's ferritin, which is stored iron. And it sounds like your ferritin is low, and you've supplemented with iron, and it stayed low. So what would be some of the reasons why the iron coming in isn't helping form more ferritin to store for your liver storage? So one of the reasons could be your gut. And that can be measured and checked. Some people have gut damage. This is especially true if you've used NSAIDs, non-steroidal anti-inflammatories, that damage the lining, and they could cause blood loss that is occult in nature. I mean, you don't see it coming out in the toilet bowl, but it comes out and it blends in with your stool. That's called occult blood loss. It can be measured. You can ask your doctor to do an occult blood test on your stool. This would be an indicator that you have gut damage. Now, NSAIDs aren't the only thing that can cause gut damage. Viral infections can cause gut damage. Bacterial infections, yeast overgrowth can cause gut damage. Other medications like steroids can cause gut damage. A number of other like antihistamines and proton pump inhibitors or acid blocking medicines can cause this kind of damage as well. So with absorption, you could have occult blood loss, but you could also be taking medicines that block stomach acid. You need acid to absorb iron. And so anything, if you're taking Tums or Rolaids or Protonics or Nexium or any of those, you can create or cause an inability for your GI tract to properly absorb iron. If you're a female and you're in your menstrual years and you're having blood loss through menstruation and you have heavy cycles, this is another reason where your ferritin will never rebound, because this is especially true if you have heavy, because by the time you're recovering, you're having another cycle and the blood loss occurs all over again. And so there are a number of reasons why heavy menstruation could be a problem for a female, and most of them nutritionally related. Gluten sensitivity is an example. When women have gluten sensitivity and don't know, and they're eating gluten, a lot of times their cycles are a lot heavier than they need to be, and they develop chronic iron deficiency, low ferritin. So that's a possibility. And that brings us to, in that same category, you could have food-induced gut damage. So gluten is probably the most well-studied in terms of iron deficiency or low iron. It's a hallmark, actually. Sometimes people go their whole life, 20, 30, 40 years with low iron, and it's being caused as a result of gluten-induced damage. So just something to consider. Now, it's also possible that you're supplementing, but you're not supplementing enough. And so this is one of those things where you have to, sometimes you start at a certain dose with iron. A lot of times it's 325 milligrams a day. And it's not enough to get correction because some of these other variable factors are also in place. So it's important to understand a lot of these things. What I would encourage you to do next, now that you have some basis of information, is check out our crash course on iron so that you can learn more about why that ferritin might be specifically low in your case. Best treatment for histamine. So you have elevated histamine and you're having allergy symptoms as a result. But we won't call these treatments. We'll call them natural support agents. Best thing that you can do, in my opinion, we have a product called Histassist, which is a mixture of some key ingredients like cysteine and bromelain and quercetin and NAC. But what this does is it stabilizes the mast cells. Mast cells are the cells that release histamine. So in this regard, it can reduce histamine excretion by your immune cells, which can lower or reduce potential for allergic symptoms that you may be having or suffering from. Now, the other thing you can use is DAO. We have a product called Ultra DAO, and this is an enzyme that degrades histamine. So it helps your body break it down. There's certain bacteria that help degrade histamine that sometimes people become deficient in because of antibiotic use. And then there's genetic variants with the DAO gene where people don't make as much. And then sometimes there's a mold problem. And sometimes it's just a seasonal issue where you're allergic to, cedar or whatever it might be in the environment. But those are the two things that I would recommend starting. If you're trying to support yourself there, Histassist and Ultra DAO, both of those are great products to support your histamine. Any foods outside of this trigger, nasal turbinate swelling around 2 to 3, diarrhea and skin blistering on my hands. So you're having nasal turbinate swelling with diarrhea and skin blistering, and you're asking if there's a food trigger. I think that's what you're asking. Lots. I mean, it depends on the person. If you're not sure and it's not obvious, like you're not eating a food and it becomes very, very obvious because of the symptoms associated with the consumption of that food, within the time frame of the consumption, then it's very possible you have what's called a delayed food reaction, what's known as delayed hypersensitivity, and that can be measured. If you go to Gluten Free Society, we can put that link up for you. We have testing that you can order that will measure this to different foods, to hundreds of different foods that you may be subjecting yourself to on a regular basis that are driving, some of those things to happen. But that would be my recommendation. My daughter completed her course and moved abroad for work about 2.5 years ago. It was a very difficult and stressful period for her, being away from family and friends. Around that time, her period stopped, and she's now 26. During the last 2 years of university, she lived in a flat with significant mold. Another resident even had to spend much of the term elsewhere because his psoriasis flared badly. I'm wondering whether, in addition to the stress she experienced, the mold exposure she had up to 6 months before moving might also be contributing to her amenorrhea, and what steps she could take to recover from this. So number one is to get out of the mold. If she's still in it, get her out of there. It's life-threatening. Mold can kill you, and it's no joke. And people sometimes underestimate just how bad it can be. But there are many reasons that mold comes with 3 flavors, if you will, in terms of its ability to hurt a human. Most doctors will discuss the first one, mold allergy, which is when your immune system reacts to mold spores. So allergic reaction to spores that might be present in the environment. So that would be number one. Number 2 would be something called mycotoxin exposure. And I will couple this with some of the other things that mold produces, like VOCs, volatile organic compounds. And then they also make fragments, hyphal fragments. These are all part of the kind of the poisoning that mold can create. And this has a poisoning effect on humans. And so if you're being poisoned by these things, the only way to overcome that is to get out of the mold and then help your body remove the poisons that were put in you. And just without any kind of supplementation or treatment, one of the best ways is sweat. Sweat and hydrate, because the movement of water is going to ultimately help push this poison out of you. That's why these are such great strategies. Now, there are other things we can do, like glutathione or N-acetylcysteine, quercetin works well, vitamin C works well, supporting phase 1 and phase 2 liver detoxification of these toxins works really well. But anyway, that's mold poisoning, if you want to think of it that way. And then number 3 is that, when a person's been in mold, they can develop something called mycosis, which is basically it's a mold infection. It's where the mold from the environment now starts growing on the body or in the body, and this can be life-threatening. An example of this would be, when Aspergillus, the mold, gets into your lungs and starts forming a fungal ball, a mass that looks like cancer, looks like a tumor, and it has about a 60% mortality rate. So you don't want to ever be in mold long enough that this becomes your outcome. This is very potentially life-threatening. These other things are also problems associated with mold. But number one thing you got to do is remove yourself from the environment or the exposure, because there's nothing else I can tell you that will fix any of that as long as the exposure is bad enough and her body can't get rid of the toxins faster than she's being re-exposed to them. So if she's not been out or gotten out of there, get her out of there. Now, the other thing I would recommend you do, we're putting together resources for people in mold at a website called moldjacked.com. Go over there. And there's a bunch of great information already there, a bunch of specific videos around mold and mold toxicity, but also a bunch of really good articles and other tips that you should share with your daughter so that you guys can get her back up and going in the right direction. How to recover gut health after using ibuprofen. Your body's going to naturally start healing itself, but the biggest thing when you stop the ibuprofen use to understand is the damage is there, right? So how do you help your body repair that damage? We have a couple of things that we help or that we recommend people use if they've got chronic histories. One is a supplement called GI Shield. And what this does is it contains several ingredients. One of them is L-glutamine. L-glutamine is the primary fuel source for gut cells. So it helps to fuel the cells so that they can make new cells and heal and repair the lining. But it has also other things in it that produce they're called mucilaginous, but they produce a mucin that helps to coat and line the damaged area. And then this way, that area, so what happens when you have damage, when you have a damaged area in the gut, all you have to do is eat food, and the food itself becomes the irritant to the already damaged area. It's kind of similar as when you have a cut or a scab or a cut that's trying to heal on your skin, and all it takes is for you to rub it wrong or hit it wrong or get something on it, and it re-irritates it, right? And so a damaged area is more prone to irritation just by the act of eating. So this stuff here and GI Shield is designed to kind of coat that damaged area so that there's less irritation over time and those cells can start to heal. But that's where I would start. Now, the other thing that you could consider is to understand that ibuprofen depletes folate, vitamin C, and iron. Now, as it relates to the lining of the GI tract, folate is very, very important B vitamin that helps these damaged cells repair, but it also helps the gut lining make new cells. And those cells will turn over so rapidly. Every 2 to 7 days, your gut lining's being remade. So you need a lot of folate for that. So if you've been on ibuprofen a long time and your folate levels are really low because of it, it's going to be an impediment to your gut's ability to repair itself. The same thing is true of vitamin C. Vitamin C is an anti-inflammatory effect in the gut. There's some studies now showing that, especially the studies I'm referring to are in those with gluten issues, where vitamin C actually can help repair the historical damage. So when you're on a medicine that depletes two things that are key in the ability for your body to repair from that damage, it can sometimes be a rate limiting step. So I would consider all of those things. Do you have a certification training for health practitioners that don't have prescriptive authority? I am a PT and would love to get some formal training in everything you teach. Thank you. You're welcome. That's a compliment and I appreciate it. We're working on something for the next few years. I've taken on a new doctor in my practice, and my son's in school now, and he'll be coming on board hopefully in a couple of years. As my ability to open up my schedule expands, it's actually one of the top things is to create a practitioner course. So if you're not already, subscribe, and when that's ready, we'll let you know. What nutrients would help eczema flare-ups? Depends on what's causing the eczema flare-up. In my experience, most of the time, eczema flare-ups are caused by a few different things. Gluten, dairy, sugar. These are the top three. So if you're eating these and you're trying to heal an eczema flare-up, good luck. It's probably not going to happen. These are always, in my experience, playing part of the role. Now, in addition to that, there are certain nutrient deficiencies that can contribute to skin inflammation, mostly B vitamins, vitamin D, and zinc. So, you can get these measured to determine where you might go. You could also potentially cover all three bases. It's relatively safe and easy to do. But again, I want to emphasize triggers over supplementing for cures, because there's no supplementing for cures. There's triggers. And when we think about what triggers eczema, it's usually something somebody's eating. It can be environmental toxins as well. Mold is a common trigger. both environmental mold as well as internal yeast overgrowth can be a trigger. But the reason the yeast is there inside is because of the sugar and the gluten foods that are high carbohydrate. Like that's what feeds the yeast to overgrow. So really, if you control for what feeds it, then you weaken it and you have reduction potential for the flares. And then if you give your skin the nutrients it needs to heal and repair from the damage, it will. So think of this as more of a two-pronged approach. Don't do one or the other. It's more, typically it's you have to do both. You've got to change your diet. You've also got to understand what nutrient deficits you have that are an impediment to how your skin can heal and repair. Let's see. I'm not sure I understand this question. If the doctor's blood work shows deficiency, does that mean that the intracellular testing will be positive as well? I'm not sure I understand how you're wording that, Catherine. If you're saying if the doctor's blood work, are you saying if the doctor that you're seeing, not me and not my clinic, but another doctor is doing serum lab testing, maybe that's what you mean. Serum lab testing is junk. I don't rely on serum lab testing to make any kind of major important decisions around micronutrient supplementation or not, because it's so misleading. So I wouldn't even call it valid. I mean, it's so invalid that the University of Texas dedicated an entire department in biochemistry and 20 years of research to solve the problem of serum labs being inaccurate. And that's what we use. We use the technology that came out of that dedicated 20 years of research. It's called INA, Intracellular Nutritional Analysis. I did your INA test, but I don't see vitamin B5 on it. Is it on there by another name? Yes, it is. It's on there by the name of pantothenic acid. So look again, you'll see that term pantothenate or pantothenic acid. That's vitamin B5. Is it safe to supplement D3 for a male with a heterozygous prothrombin mutation? Well, that's a pretty specific question. 60 years old and had 2 event-induced PEs 10 years apart, total recovery. I mean, vitamin D, it's safe to supplement. Whether or not it's safe to supplement specifically in your case, I don't have enough information. What you've provided to me doesn't give me enough information, but understand that it's safe to supplement with vitamin D. There's really one major contraindication to supplementing vitamin D, and that's if you have a severe kidney dysfunction. Probably the biggest illness linked to that would be somebody who's been diagnosed with sarcoidosis. And this has to do with the damage happening to the kidney can lead to a calcium. It's not even that the vitamin D is dangerous. It's that the kidney can't properly filter calcium. And so when you take high doses or higher doses of supplemental vitamin D increases calcium and the kidneys aren't able to properly filter it. So the serum calcium goes up. And the problem, if your serum calcium gets really high, it can cause the risk of heart issues. So if you don't have sarcoidosis, probably not a contraindication to using vitamin D. That being said, it's always best to get your levels measured. And one of the ways to test vitamin D with your doctor is to measure this right here, 25-OH-D. And you want yours to be somewhere between 50 and 100. And if it is, you're in a good place. If it's not, you can consider. But if you're really concerned about the potential for complications, monitor it, get it measured. Once you start supplementing and get that test checked, insurance will cover that particular test. So you get it tested a couple of times a year, and that'll give you a good indication as to where you're at. I heard glutamine is good for a person that has had or that has issues with alcoholism. Is this true? It can be true. Glutamine, alcohol damages the gut. Alcohol is one of the, when we talk about celiac disease and And villus atrophy, the small intestine, caused by gluten. Where am I going with this? But alcohol can also cause villus atrophy. It's one of the fundamental flaws of celiac disease biopsy testing is that when you have positive villus atrophy, it doesn't necessarily mean it was caused by gluten. There are other things that can cause it, alcohol being one of them. And so, from that perspective, you've got villus atrophy. How do we heal the gut? One of the main fuel sources for the enterocytes is glutamine. But there's also some research that shows that glutamine supplementation can reduce alcohol cravings. So if somebody's trying to come off of alcohol and they're addicted, this is another one of those nutrients that can potentially be helpful. As I was saying before, when I was talking about addiction, there are a lot of nutrients that play a biochemical role in addiction physiology, and glutamine can be one of them. So yes, what you heard is true. I just don't know how you heard it. It's safe to answer that one. If someone's gut is compromised according to the stool test, how should one get nutrients in if we aren't absorbing through the gut? There's no such thing as you're not absorbing. If you weren't absorbing through your gut, Sandy, you'd be dead. Because it's not, so don't think of it in terms of all or none. Think of it in terms of grayscale, right? So it's not off or on. If you have damaged gut, it's somewhere in between, like a dimmer switch. And so to what level is that malabsorption? Now, I don't know what your stool test said. Stool tests can pick up on things that would indicate malabsorption or damage. There are inflammatory markers. There are different enzymes that get measured in stool that can indicate a malabsorption. There's something called steatocrit or fat content of the stool that can indicate malabsorption. So if those things were measured as abnormal, you have to figure out what's causing it. So if you're somewhere here, let's say this is you, on the spectrum of digestion absorption, the bigger question isn't, can you absorb nutrients? Because you can, you're still alive and you're still here today. But why is the damage or the malabsorption there? Yeah, this is it. You've got to answer this question. There's no amount of anything else that you can do. If you answer this question, then you can move up the spectrum to better digestion and absorption. What are the primary drivers of intestinal damage? What you put in your mouth. That's number one. You always have to consider that. Food sensitivity, food allergy, gluten, dairy, sugar are the top three that can damage a person's gut. But then food additives, food preservatives, food dyes, pesticides, medications used to treat the symptoms of gut problems, all can cause gut damage. Vitamin deficiencies are the later consequences for most people. The deficiencies occur as a result of you being less over here and more over here. The problem with that is that once you develop the deficiencies, you need to get the nutrients still have to be given, whether you're ideally absorbing them 100% or not. They have to be given because the nutrients are what allow you to heal, to get back to here. So it's not an issue of I'm not gonna do anything extra with my nutrients over here because my gut's damaged. It's more along the lines of let's figure out why the gut's damaged, fix that, while simultaneously giving the nutrients that the body needs to push this in that direction. So hopefully that gives you better context. Because it's not an all or none situation. And sometimes when you do push the right nutrients, even if the diet isn't perfect, you can make a lot of headway in terms of how somebody responds or improves. Arthritis, RA and OA, how to stop, process, and reverse and regenerate cartilage and reverse spurring of calcification, spurring, I assume you mean, and calcification of the vertebrae and other joint bone structures. So, I mean, hands down, if you've got RA, you need to read No Grain, No Pain and get on the diet. Like last week, last year, last decade, as quickly as you can. The diet, that book was designed for autoimmunity. So no grain, no pain. If you do it for 30 days, do the protocol in the book for 30 days, there will be improvement in a big way. If there's not improvement, probably one of two things is true. You're in mold, or you have Lyme arthritis, which is a bacteria. So, but do this first. It's, you know, it's as cheap as a copy of the book, or you could go check it out at the library, but this won't cost you anything. Once you do this, if you get improvement, you know you're on the right track. You don't need to worry about exploring these other two. But if you do this and you have no improvement, if you're non-diet responsive, then you need to get with a good functional doctor. You can call my office if you'd like, or somebody else who's qualified, and you need to talk about mold potential and Lyme potential as being drivers of your RA. As far as reversing spurring and nutrients to heal the cartilage, this just goes back to testing, vitamin and mineral testing to determine what your body specifically needs. And then as far as the spurring itself, depends on the extent of the damage. Whether if you've had x-rays, you know, some damage can be permanent to the extent if you've got like osseous erosions. A lot of times those stay even when you make all the right changes, but the good news is the pain can still go away. What we don't want is a progression of the disease. And if you have a progression, that's when the medicines, well, they're already taking their toll depending on what you're on, but that's when the medicines sometimes quit working altogether, because the RA leads to decimation of the joint, which leads to a pain that no drug can solve, because it's a physical disruption of the joint. And that's, you know, you're not going to solve that by inhibiting inflammation. What can cause a high vitamin D serum level of 135? Hi, Doreen. Good to hear from you. High vitamin D, so a couple questions. Is there supplementation that's been going on? Did somebody, or is somebody supplementing? Because that's the biggest reason we'll see a high vitamin D is supplementation. And sometimes what happens is somebody will do like a high dose therapy of vitamin D, which is called STOS therapy. And so what'll happen is they'll do like 150,000 units times 3 days. And then maybe they go to the doctor and it's, you know, 2 months, a month later, and that level's 135, not because necessarily that they're toxic, but because this level bolstered their blood to such a degree that it stayed elevated. That's what I typically see. I get people all the time in my practice that they do that preventative cold and flu preventative dose, and then we get a couple months later, we get their vitamin D levels back and they're high. But that's what I would look to as the potential for it. I've cut down all grain and dairy because of my autoimmune, hair loss, and Hashimoto's. My only carb source is fruits and dates. Is it okay not to consume complex carbs? I'm not defecating daily. Maybe, maybe not. I mean, it's an individualized question. Some people don't always require a lot of complex carbohydrates, but you might consider adding in some root-based vegetables like sweet potato, or even yucca or cassava, where you're going to get some fibers that could potentially have an impact on your daily bowel movements. So it's hard to say for sure, because there's more to it even than that. But I would say I would look at those things as potential solutions. You might also look at taking a probiotic if you're not having a daily bowel movement. A lot of times probiotics, repopulation of gut flora, can help with that. Is there a connection between nutritional deficiencies and decreased hemoglobin levels for someone with sickle cell? Yes, it can be. With sickle cell, generally speaking, the red blood cells are formed in such a way that they're sickle shaped. So naturally, a red blood cell kind of looks like a biconcave disc, or a discoid shape, and you have like oxygen sits in that divot. You got hemoglobin in the middle that binds that oxygen or the carbon dioxide, CO2. And in sickle cell, the shape of the red blood cell is more sickled in nature. So it's abnormally shaped. And so it has a harder time with oxygen and CO2 carriage. And so one of the things that's very common in sickle cell is because of that sickle shape, the cell itself can break easier. This process is called hemolysis. Hemo meaning blood, cell, lysis meaning cut. So you have the hemolysis, and this is frequently when we see with sickle cell, we're trying to improve their anemic symptoms. We use vitamin C and we use vitamin E. And the reason why is the vitamin C helps to stabilize the membrane around the sickle so that it's less prone to breaking. And the same is true of vitamin E. It stabilizes the fatty membrane around the sickle-celled red blood cell, and it can help with reducing the damage to these sickle-shaped cells. So I would look at vitamin C and vitamin E in terms of improving symptoms if you do have a diagnosis of sickle cell anemia. It's genetic, for those of you wondering. It's a genetic trait. It's actually what happened was it was a genetic advantage in areas of Africa where the mosquitoes can spread a lot of the disease. This specialized sickle shape made it harder for the mosquito to infect the red blood cells and create severe damage. And so that sickle, that genetic sickle adaptation is a benefit against malaria. Anyway, just FYI. Is yeast overgrowth the same as Candida overgrowth? I've struggled with Candida overgrowth many times over the years. So yes and no. No, all Candida overgrowths are yeast overgrowths, but not all yeast overgrowths are Candida overgrowths. So you have Candida, and there's different kinds of Candida. So there's Candida albicans and a variety of Candida parasilosis and a variety of others. And then there's Geotrichum, which is another type of yeast, and there's Rhodotorula, another kind of yeast. And these different types of yeast can contribute to yeast overgrowth. So they're not always Candida, if that helps. Why do you recommend 100 milligrams of B2 for migraine when others recommend 200 milligrams twice a day? I can't speak for others, Melinda. And I don't just recommend 100 milligrams of B2 for migraine. I always start people, generically speaking, with B vitamins around 100 milligrams if I don't have testing or if it's a generalized question. But if it's in my clinic and we're trying to correct a deficiency, you can go much higher with vitamin B2 than 100 milligrams. But it's not a magic number, I guess, is the point I'm trying to get across. Do gut bacteria affect digestion and vitamin absorption? How can this be tested? And is it possible to check gut bacteria levels? Yeah. So gut bacteria can be measured. Gut bacteria are responsible for synthesizing 50 to 60% of your vitamin K, and same with your biotin, which is a B vitamin. And so, but these are the most well studied. So vitamin K and biotin, we know, gut bacteria are responsible for making about half of the human requirement a day. There's less known about other B vitamins as far as what the gut bacteria do. But we know that they do make some B vitamins. We just, we don't suspect it is quite this context of this much. And then there are other things like butyrate, which not a vitamin per se. It's a short chain fatty acid, but it has it's a fuel effect on colon cells, so it helps colon cells replicate and make sure that the integrity of the colon is in place. But this can be measured. These can also be measured, and sometimes we'll see, for example, somebody with no lactobacillus, no bifidobacter. They're also low in vitamin K, or they're also low in biotin. But yes, those things can be measured and tested. There is a role that bacteria play in vitamin production, and there is a role that bacteria play in how well your body digests and absorbs your food. Remember, part of the job of the bacteria is to break down difficult to digest fibers. So it helps to break your food down or digest those fibers, and the byproduct of that is short chain fatty acids that are very beneficial to your overall health. How to get rid of edema? in a 69-year-old male. Depends on what's causing it. There's several, like we're going to talk about just some things that cause it. I would always look to these two nutrients first, in somebody who we suspect has a nutritionally oriented edema. It's because both of these nutrients can cause damage to the heart, which leads to fluid accumulation in the lower extremity. So consider this, measuring these two, possibly consider supplementing. Dosing is going to be anywhere from 300 to 500 milligrams a day of CoQ10 in a ubiquinol form. And then for vitamin B1, ideally you want to use a benfotiamine, and anywhere between 150 and 300 milligrams a day would be a good place to start. But those would be kind of the top two things I might suspect, at least nutritionally. There are other things that can contribute to edema as well. Vitamin C deficiency, inadequate bioflavonoids in the diet can cause permeations of blood vessels, allow for what's called third spacing, or fluid to accumulate out of the blood vessel into the interstitial tissue, causing fluid accumulation in the legs or in the feet. But I'd start with there. I don't know if that helps you, but start there first. Can you test for butyrate deficiency? Yes, you can. You can test for butyrate levels. I take mirtazapine or mirtazapine, but want to take supplements for stress and sleep, but read that certain supplements can't be combined with it. Which supplements and ingredients I should stay away from? Well, that's too complex of a question, Danielle, because I don't know anything about your history. It'd probably be irresponsible of me to just give you a list. The best thing that I would suggest that you do is whoever's prescribing that drug to you, hire a good functional doctor, connect that doctor with your psychiatrist or your GP, whoever's got you prescribed mirtazapine, and have them have a conversation with your history in mind, so that they can come to the best possible way to help you in your long-term goal. If it is to get off that medicine and to be able to cope with stress naturally and sleep well, then between the two of them, they could create a plan that would help you wean in the right direction as you use nutrition as a tool. Any new information about healing pre-tibial myxedema? I mean, if you've got a myxedema, you need to get tested. I mean, there's not like a magic pill that you're going to take in that regard. You got to get tested. Same thing, question about cellulitis on the face. Well, you need to get medical attention to that, because that could deform you, and it could also be very life-threatening. But you need to get high-quality medical attention on that, and then subsequently you need to get your nutrition dialed in. Best supplement for sleep to combat the stress hormone cortisol. It's not a best. There's good. There are several things that you can do. A couple of my favorite things to use. We have a product. It's called Ultra Calm. And it's a blend of different things. You could also use theanine, which can help with that. You could use serine. That might be helpful for that as well. I mean, I'd probably start with those three if you haven't yet. Like none of these will cause addiction or dependency in that regard. I don't necessarily recommend jumping right into like melatonin as a first line of defense in that situation. But at the end of the day, you got to figure out what's driving the insomnia. Where's the stress coming from? If your cortisol's high and you have insomnia because of it, what's spiking your cortisol? There's 4 triggers: food, chemical exposures, microbial imbalances, and nutritional deficiencies are all going to have the impact potentially on your cortisol elevation, which will cause poor sleep. I'm celiac. Best way to get rid of glaucoma? Well, if you're celiac, you need to follow no grain, no pain. You've probably been given like a classic gluten-free diet, which tells you to avoid wheat, barley, and rye. But then, if you're like many celiacs, you're going to the grocery store and you're looking for the gluten-free bread options and the gluten-free cereal options. And the primary ingredients in those things is typically corn and rice, both of which can be damaging. And one of the side effects to that inflammation can be damage to your eye, including glaucoma. So you need to get on the no grain, no pain diet if you're celiac. Get that corn, rice, oats, sorghum, millet, and all the other nonsense grains out of your diet. That would be first step. Then I would suggest that you test your nutrient status. So get an INA, intracellular nutritional analysis done. Without testing, you would think about vitamin A. You would think about taurine as key nutrients that your eye needs to heal and repair itself. And along with vitamin A, you have to also think about zinc, because zinc carries vitamin A to the eye. It's the taxi cab for vitamin A. But I would look at these nutrients in a big way. But ideally, if you were coming to see me, I would do this type of testing, and I would make sure that your diet was dialed in as a first place to start. Let's see here. Can I be on your Ultra D for a long period of time? Because I read that high-dose vitamin D changed the immune system and how to act. I don't recommend being on high-dose vitamin D indefinitely without testing. I mean, if you're going to be on it, you can be on it for a few months. If you're talking about the ultra high dose, the 50,000 unit capsules, I don't recommend you take one a day indefinitely, but you could take one a week for several months and then recheck your level to see how you're doing. But I don't recommend. I mean, the therapeutic dosing of vitamin D is between 8,000 and 10,000 units a day, and you're talking about Ultra D3, which is 50,000 units per capsule. So again, short-term use, great. Long-term use, monitor your levels. Question, sensitive to pharma drugs, not unhappy by that, but even react to saline IV. Besides digestive enzymes, doctor recommends, what else should I be looking into? That's an odd question. I'm not sure I understand the way you're asking it. Ehlers-Danlos, POTS, MCAS, Hashis, Addison's, those disease diagnoses that you have. You're following no grain, no pain, and you're on some supplements. I maybe reframe that question specifically answering, and I can give you a better thought. Let's go down. Been on a grain-free, moderate ketogenic diet, feeding the microbiome with various fibers. How to stop the processes affecting cartilage and bone, and how to regenerate new tissues naturally. What process is affecting your cartilage and bone? Do you have so you're rheumatoid, or are you osteoarthritis? If you're rheumatoid arthritis, and you're still, if you're grain-free and you're with rheumatoid arthritis and you're still struggling with persistent damage happening to your cartilage and bones, you need to get additional testing done. I'd start with food sensitivity measurement. So beyond the grain, what other foods could be triggering for RA? So food sensitivity testing and micronutrient INA testing, because to heal, for the joints to heal, for the cartilage to grow and repair, you need nutrients, but you need to know which nutrients you're lacking, which ones are going to be the most beneficial for you. This is not a universal answer. The same thing, just like with food, is not a universal answer. One man's food is another man's poison. So you have to understand what else you could be reacting to if you're still having inflammatory progression of your arthritis. My serum lab tests are all over the place and I don't know what to do. My doctor suggested supplementing with iron, But ferritin's 44, iron's 225. Yeah, you don't need iron. If your serum is 225 and your ferritin's 44, you're not most likely iron deficient. So I don't know. Your iron binding capacity is low. That doesn't mean your iron is low. This is a mistake a lot of doctors that don't understand iron testing make. When you say your iron binding capacity, IBC, sometimes UIBC, is low, this means that you have low capacity to bind more iron. So taking more is not the solution. Basically, it means that your cells are saturated with iron adequately. This is not an indicator of iron deficiency. The doctor just sees low and they say, oh, low iron binding capacity must mean low iron. And they put you on it. But your serum's 225. As long as your serum is, if you're a menstruating female, serum needs to be 90 plus, you're okay. Ferritin could be higher, but it's not so low that I would think, oh no. Ferritin ideally 75, but at 44, with the other factors and other numbers that you have, iron deficiency wouldn't be the thing that would be at the top of my list of things to make a recommendation that would be helpful for you. I don't know if that helps you or if that makes you more confused, but your saturation is high and your binding capacity is low indicates you don't have an iron deficiency. So iron isn't your solution in this case. Scroll down. How can chronic Cipro use be countered? Cipro has been prescribed by doctor for knee replacement infection for an 80-year-old. Oh, why Cipro? If she hasn't already started it, what I would do is say, why Cipro? That's like the Canon when you're going rabbit hunting. It could be too strong. And it's an 80-year-old. And so then there's also do you really need the antibiotic, or is this just a just in case kind of a scenario? I understand doctors' concerns, especially in a potentially immunocompromised 80-year-old, potentially, but I don't know enough about the history of the 80-year-old to know whether or not we have to worry about immunocompromisation. I would, more than anything, I would encourage my surgery protocol. If you don't know what that is, let's put a link up to the opt-in for that surgery protocol so that Crafted can do that. But that's what I would recommend. I'd recommend going into surgery well nourished, because that's your best bet against reducing the potential risk of infection. As far as countering Cipro, I think it's too strong of a choice. You could use, we have a probiotic that I would use called Ultra Biotic Defense, and I would be on it for at least a month during and after Cipro. But even more importantly, let's reduce the risk of a potential infection prior to surgery by being well nourished in advance. I'm so excited you're live right now. Are there any home remedies for SIBO, leaky gut, and Candida? You got to figure out why it's happening. I keep going back to cause versus pill fixes. But with SIBO, a lot of people respond really well to berberine and olive extract, olive leaf. These are just two natural herbals that have antibiotic properties that many people with SIBO, when the rifaximin and the other medical treatments don't work for them, find helpful. As far as leaky gut and Candida, I mentioned, we'll put a Candida link up for you on the Candida part, but I like caprylic acid. I have a product called Yeast Shield. And as far as leaky gut goes, it just depends on what's causing the leaky gut, because there's not like a one-off pill that resolves leaky gut. If you haven't already, read No Grain, No Pain. In that book, under the gut chapter, there's a diagram of all the different causes of leaky gut, right? So people always like, what do I do for what can I take for my leaky gut? You can not take something, but determine the cause, and the gut will quit leaking. That's funny. I will move to Sugarland if you have any kind of nutritional training class. Well, we were thinking about putting together a number of years ago. We did, maybe some of you watching attended, but I did some really big seminars locally here at the medical center. We did the glutenology seminar, and it was a weekend where we had guests, experts, and speakers, including myself, and we had general ticket sales, and we invited the public, and we had, I think at that event we had like 1,000, 1,500 somewhere in there turnout. It was a nice day to bring awareness to the community. We've been throwing the idea around of doing something like this again. Those of you that might be interested, again, since the question came up, let's just poll the audience. How many of you would be interested if I threw a big event here in Sugarland, Texas? How many of you would be willing to come? How many of you would be willing to travel to attend an event like that? Best form of magnesium for ADHD and sleep in kids. It's not a best form. Any chelated form would work fine, just not magnesium oxide, Sandy. I mean, I'm partial to my own formula, which is Ultra MG. That's available at Gluten Free Society, and that's what I would use if it were my child. But magnesium chelates are all relatively equal in terms of their propensity to be absorbed well. Why are we using serum lab tests that do not help? Is it not covered by insurance? It's a long story. It's not. INAs aren't covered by insurance on purpose. You guys got to understand. In my opinion, there is a nefarious force behind keeping real medicine out of the people's hands. I mean, look at the last 50 years. I mean, how many times have you heard common sense things be attacked by mainstream medicine because it threatens the monopoly of what they've established in the last 50 years? Mainstream medicine has miserably failed everyone. And when I say everyone, I don't mean acute care, emergency room doctors saving people's lives every day. I mean anyone with a chronic autoimmune, anyone with a chronic inflammatory degenerative disease. It has utterly failed those people. And that's the majority of people. It's failed to do any kind of prevention, right? 60% of us are overweight. The odds of you dying from cancer, heart disease, or drug overdose, prescriptive drug overdose, are the top 3 causes of death. How is a system that's allowed that to happen still flourishing as a monopoly and still profiting, hand over fist? I mean, if you look in my backyard, which is Houston, our medical center in Houston is like the Vegas Strip of medicine. It's row after row of massive skyscrapers owned by corporate hospital systems that are not having effective outcomes in chronic disease, and that just keeps being fed and fed and fed. So when you ask if INA is going to be covered by insurance ever, my answer to you in an honest assessment is it probably won't ever be until there's a massive overhaul of who's in power. And I don't think medicine's going to fall over and just say, yeah, we're wrong now. They're going to double down on everything they've been wrong about, despite the fact that it's, in my opinion, maiming people. How could I correct bone loss in my jaw and overall osteoporosis? Chew your food would be one. I mean, that sounds silly, but bone grows based on pressure. And if your jaw has been found to be poor bone or less bone or osteopenic or porotic, you need to chew. And so a good xylitol chewing gum, where you're chewing a lot frequently to put the pressure into the bone, because it's the pressure that stimulates the bone regeneration. But you also need the nutrients for bone regeneration to occur. We do have something called Bone Box, the Bone Box supplement. It's a couple different supplements that you take in conjunction with resistance. Whether if it's your jaw, it's chewing. If it's your rest of your body, it's resistance training and exercise. But that's where I would recommend you start. I have AS and HLA-B27 positive. I am on Humira, and in this condition, Klebsiella bacteria overgrowth that comes from starch. Is it contradicting to use supplements for immune system? Why would it be contradictive? Humira suppresses your immune system's ability to generate inflammation as a result of the damage caused with the ankylosing spondylitis. There's not a contraindication to using nutritional support. What you should know, what's the bacteria you have there? Klebsiella. So Klebsiella produces an LPS, which is an endotoxin that can cause a leaky gut, traverse to your joints, and drive inflammatory damage to your joints, including your spine. With ankylosing spondylitis, a lot of times it's in the spine. I don't know where your primary areas of inflammation are, but you should understand that Klebsiella is part of that, most likely. There's good documented data on the endotoxins from these bacteria, these gram-negative bacteria, driving leakiness that leads to the inflammatory damage. So you need to deal with that Klebsiella. I don't know how you found out you had Klebsiella, but ask the doctor who identified it to do what's called a culture sensitivity test. It's basically is where they determine what the Klebsiella is sensitive to, and so what antibiotic to use or natural agent. A lot of times we see Klebsiella, we do culture sensitivities in patients with AS and rheumatoid, and this is a common finding, is Klebsiella is a driving force behind those autoimmune arthritides. And so the sensitivity test oftentimes reveals that uva ursi, which is a plant botanical compound, or even berberine, sometimes caprylic acid, and others. We test for a lot of different natural components, but because you want to know what to do to kill it. You want to know what to do to suppress its growth, right? That's what the sensitivity part of the test is designed to help you discover, because many bacteria like this produce biofilm. And this biofilm is like a protective dome that basically coats the Klebsiella colonies. And so when you take an antibiotic or when you try to get rid of it, that dome protects the bacteria, makes them more resistant to treatment. So you want to sensitize or get a sensitivity test to it so you can kind of better determine how's it going to die if you're going after it. I don't know if that helps you, but that's something that if they didn't talk to you about, if your doctors didn't talk to you about, you need to make sure that you bring that up. But supplements for the immune system specifically, I mean, you could ask, which supplement, I could ask you which supplements that you're referring to in terms of taking. But if you have AS, your vitamin D first and foremost should be being checked, monitored, and you should be supplementing to get it up between, in your case, 70 to 100 range. But just general rule of thumb, micronutrient supplementation, vitamins and minerals are not contraindicated in people taking Humira at all. As a matter of fact, in my experience in dealing with lots of autoimmune arthritides over the last 25 years, is that it's the vitamins and minerals that save you. Because when you suppress the immune system, the natural consequence to suppressing the immune system and being on Humira long term, and this is a black box warning on that drug. You can just read the drug label, but it has a black box for cancer. And one of the things, because it's suppressing the arm of your immune system that helps regulate cancer cells. Well, what helps that? What else helps regulate cancer cells in the human body? Nutrients. So if you're going to be on Humira for any length of time, we want to make sure your nutrient levels are like dialed in tightly, because we want there's not one mechanism that defends you from cancer. There's multiple mechanisms, many of which require nutrients. So if one of your mechanisms to fight cancer is being blocked by Humira, we want all these nutrient systems working better to help you reduce your risk of potential development. But your long-term goal, in my opinion, it's possible, I see it, is to be off the Humira altogether. And you don't want to just cold turkey quit a medicine like that, but get with somebody who understands these things. You can reach out to our clinic if you'd like, Olga. We'll put the contact information up, and get it dialed in, because AS is one of those conditions that if you get your diet and your lifestyle dialed in, you may find yourself dropping the Humira and feeling fantastic. Any natural supplements recommended for Parkinson's? Okay, specifically your feet feel like they're on fire. There's a name for that. It's called burning neuropathy. And one of the things you should attempt anytime we see a burning neuropathy, it's pathognomonic, meaning that it's a hallmark of vitamin B5 deficiency. So I would jump on vitamin B5. If that were me, I would be taking about 500 milligrams a day. We have something called Ultra B5 at Gluten Free Society if you're interested, but I would be on 500 milligrams a day with a burning neuropathy. And I might go as high as 1,000, even as high as 2,000, depending on how effective starting out at 500 were. I'd give it a few weeks first. But a burning neuropathy is a hallmark of vitamin B5 deficiency. Outside of that, with Parkinson's, it depends on what's driving it. Some of the biggest factors that drive Parkinson's disease that we see in clinical practice are gluten. If your diet hasn't changed, no grain, no pain. So I'd be on that diet for sure, because a lot of the factors that drive the autoimmunity behind Parkinson's are in the food categories. The other thing I would look for, though, and I see this a lot with Parkinson's, is mold. Go over to Mold Jacked. There's a quiz that you can take for mold that gives you a good general idea of whether or not there's a potential that you're in a moldy environment. Take that quiz and see how it comes back. But if it comes back positive, strongly consider to get a mycotoxin test done. A mycotoxin test will tell you whether or not you're overloaded with mycotoxin, which is an indicator that you're in mold. And because if you have Parkinson's and you're in mold, it doesn't matter what supplements you take, you're not going to get better, because mold is a neurotoxin that can drive Parkinson's pathology. So you want to understand that so that you can get it under control if it is part of what's going on. I mean, all of you guys, a lot of you are asking specifically about different biologics, and the question coming in about Skyrizi. You want my opinion? Is these drugs will work to shut down your immune system extremely well, but they don't solve the problem. You're taking a medicine to suppress the symptoms without understanding why the symptoms exist. And it's definitely a Band-Aid. I could see your comment. Skyrizi is not a solution. It's a Band-Aid, but a strong-willed kid and a dad. I mean, at the end of the day, here's the problem. The question was asked earlier, Dr. Osborne, do you ever turn patients away? And I said, no. Generally, patients turn themselves away when they feel like they're not a good philosophical fit for what we do. And I appreciate that, because I don't want to coerce or force anybody to do something they're not comfortable with. But if your son has this problem, and the dad and the son want to use meds, and they're not open to diet change, but here you are, and you're like, I know that this is not an answer, and this over here, this natural diet solution component is, your job is to try to convince of this direction, and that's a tough place to be. So I'm just trying to give you life advice. Maybe it's not the best nutritional advice, but life advice in the sense that I would say this: if you could get your son to follow no grain, no pain, maybe incentivize him in some way, for a solid I'd go at least 60 days, because you got to get the antibodies, which have a half-life of 30 to 40 days, sometimes more, but you got to get that down enough for symptoms to start improving. But if you could possibly get your family on board for that, that would be a great place to start. But if they're just adamant about, no way, I'm here, this is where I want to be on the meds, then your job is just to plant the seed. Plant the seed of the other way, because ultimately one or two things is going to happen. Either they're going to just stay happy here and that's where it'll go. And because he's old enough to be a skeptic and want to do his own thing, you're not going to do anything in that relationship other than make it difficult if his attitude is this. But if you plant the seed in the right way, what may happen, and what we oftentimes see happen, is that this stops working and the symptoms progressively worsen. And now nothing's working. And so now pain of illness, we'll say, is the greatest motivator for change, even if it's something maybe somebody's initially skeptic about. And the world of natural medicine, 99% of the population is skeptic about it, because we've had decades of rhetoric and decades of intentional call outs, right? I mean, when you look at some of the mainstream stuff, you see things like wellness industry is quackery, and natural medicine is quackery, and chiropractic is quackery. And ultimately what you're really seeing is a purposeful attack that's being led with intent by a monopolized healthcare system that's a profit motive system that has no desire to get anybody healthy, but just wants to keep everybody hopped up on drugs because it's a really profitable place to be. And they want to monopolize that. And anyone who's trying to do it differently, and especially if they're successful, they get attacked, they get thrown under the bus, they get investigated, etc. I know we've had all of that happen that we fought. But at the end of the day, if your son gets to this point, that's where the change is going to happen. If he's not to that point, you could beat your head into a brick wall as much as you want. And as a mom, there's no probably to it. You love your son and you want what's best for him. But I'm just trying to give you life advice that unless the person's willing to make the change themselves, there's nothing you can say or do that's going to force that change for them. And so all you can really do is be supportive and plant seeds as effectively as you can, so that ultimately either they get to hear, or the idea of you planting the seed becomes their own idea, right? Especially with men, they're really stubborn. They generally, skilled women have an art where they can kind of guide their man or their man children into the right direction by planting the right seeds. And I would suggest you work on that more than anything else, because otherwise you're going to stress yourself out over the health of your son, who's not willing to do what you feel like is the right thing for him to do. I have chronic diarrhea 7 times a day, usually a couple of hours after eating. It's probably due to mold exposure. Does having diarrhea mean I have malabsorption? Most likely, yes. You're not going to, if it's due to mold exposure, Kersey, you're not going to change it until you get out of the mold. You got to address the mold. Now, that's saying if it's due to the mold. I don't know how you came to that conclusion, if you've had some testing done and already had confirmation of that, but then you could try probiotics. Sometimes a really high dose ultrabiotic defense can stop diarrhea, or at least reduce it. If you haven't been tested for food sensitivities, I would strongly encourage you to do that, because it could be more than one thing driving it, right? Everybody's entitled to more than one problem, so to speak. So it could be mold plus other foods. One of the things that we see when people are in mold is they develop allergies and sensitivities to more and more things as time goes on. Allulose is a sweetener often made with corn. If it is in the ingredients list of a supplement that is gluten-free but does not state it is, would it most likely be made with corn? Not necessarily. Call the manufacturer. There's sources of allulose. I'm not in any of my stuff at this point because I'm waiting for a few more, probably 5 to 10 more years, just to see that it plays out. The safety signals of it plays out over time without problems. But there's date sources of allulose that are in different supplements that are fine if you're trying to follow a gluten-free diet. What is happening when pills hurt the throat when going down? It may just be too big for you. You may be having some vasospasm in the actual esophagus, and so that's closing in on the pill and it's causing kind of a scraping effect. To prevent that, the easiest thing to do if there are capsules is you can break them open and mix them into some type of pureed food. Applesauce works really well for that. Depending on what the supplement is. If it's a sulfur supplement like cysteine or glutathione, it would taste pretty bad. But if it's something like magnesium or minerals or a multi, generally you can mask it really well by just blending it in something pureed. I have insomnia and restless legs. Nothing helps me sleep except Unisom, but now they say it increases dementia risk. 77-year-old and sleep problems since I was a teenager. Susan, have you watched our show on sleep? I did a whole deep dive on a number of different factors involved with sleep, including supplements to attempt to try. Can we put that link up for Susan on YouTube? How would one address the issue to reduce food sensitivities? Maybe too complex a question. So if you're trying to reduce food sensitivities or other sensitivities, you got to ask fundamentally, is there something environmentally happening that's hypersensitizing your immune system to be overreactive to the environment and to what you're eating as time goes on? And the number one trigger there is mold. And so, that a lot of people, especially people with Ehlers-Danlos and mast cell activation, very, very common. They're in mold and they don't know it. And so getting inspected for that. As I mentioned earlier, go to Mold Jacked, take the quiz there, consider getting mycotoxin testing done. And, pending those types of results being positive, then you get into the investigative scenario of mold inspection. And before any of you think to hire a mold inspector, make sure you read my article on how to hire a mold inspector and what not to do as a mold inspection, because so many people hire inexperienced mold inspectors. And it's like going to a doctor when you're chronically ill and the doctor runs a just standard blood work, a CBC chemistry, they come back normal. The doctor says, you must be healthy. It's all in your head, and sends you to the psychiatrist. It's a lot like mold inspection, because they don't do a thorough inspection. They have a limited test that they use that doesn't always find mold. And so then they just tell you that you don't have a problem. And then you think you don't have a problem when you do, and then you stay in the mold and it continues to make you sick and drive issues. What's your thought on black seed oil? Been told it helps with inflammation. It does. It's an anti-inflammatory oil and you can use it. But if you have chronic inflammation and you're not solving for that part, then black seed oil just becomes a natural Band-Aid to the problem. It's a green medicine option for reduction of inflammation, but it's not a long-term solution for causation. So you have to be careful there. Let's go down under. I've been under a lot of stress. Any recommendations on vitamins for stress? Specifically, for stress, there's several supplements that I like when somebody's under stress. Like there's a stress they can't control, they're going through it, and they're just trying to help their body get through it. I like vitamin B5. So we have something called Ultra B5. Its nickname is the anti-stress vitamin. We have something called Ultra Adrenal. support, and it's got B5 in it, plus other things like glandulars and other nutrients that help support stress. And so this is another one that I like, and you can get both kind of combined. You can get the B5 in that as well. Also like theanine, especially like theanine if the stress is completely outside of your control and you're not able to sleep very well. I like to pair this 200 to 400 milligrams of theanine at night before bedtime with glycine. And with glycine, it's about 3,000 milligrams or 3 grams at night. So pair this combination for a lot of people when they're under intense stress and not sleeping well, this combo can work really, really well. And then this can help you with the nutrients that just help support your adrenal glands' capacity to continue to function under high amounts of stress. So these are supplemental support helps that you can do, but ultimately you want to get out of the stress, right? Because at the end of the day, if the stress doesn't go away, that's where the risk is. Let's keep going down. Have a shellfish allergy and bought your bone box but could not use. What would you suggest for osteoporosis? I'm 78. Get tested, Valerie. Get tested. Because if you can't use that bone box, the bone box got a lot of different nutrients in it, and it's kind of like a catch-all sweep for driving bone growth. And there's other things that you can use, but ultimately getting tested is going to give you a better alternative. Because I mean, there's a lot of things you can use. What's important for bone? You got vitamin D, you got calcium, you got magnesium, zinc, and copper. You got selenium, B vitamins, vitamin K, vitamin A. Like, it's all important, right? So where do you start and how much do you start? This is why get an INA test and then dial that in first and foremost. That would be your best option. Family member recently diagnosed with early dementia, history of MVA years ago with damage to teeth resulting in multiple root canals under a lot of stress for the last 4 years and possible home mold exposure. Also received the COVID vaccine, noticing the cognitive decline over these past 4 years, wondering where to start the investigation. What functional testing? What will the house? Well, we'll have the house tested for mold. Yeah, make sure you check out that mold that guide at moldjack.com on hiring a mold inspector. And if you're in the Texas area, in the Austin area, I strongly recommend Texas Mold Inspectors. Great company. They actually, the husband and wife, lost a child to mold poisoning, mold toxicity. So if anybody's going to take it seriously, they will. And request Josh to come out and do the inspection. He'll do a great job. And if you've got a problem in that regard, he'll find it. As far as where else to start, just functionally, I'd start with dementia. I'd start with micronutrient testing, and I'd start with food testing, because those are big needle movers of things that can be done. Changing the diet can be done really simply. Adding nutrients to the diet can also be done really simply. Beyond that, it can get more complex depending on the history and the details of what else may be going on, but that would be where I would start first. Let's see here. Diet and exercise, just let's see, go down a little bit. My son has been sick for 4 days, bad cough, chills, and extremely tired. Any recommendations? Laura's asking. Can we get Laura the immune protocol? Laura, we're going to plug in the immune protocol for you in the feed, a link to that. And, you can start with any number of those different strategies in that immune protocol. I'm celiac, was in the hospital on IV antibiotics 5 days last week for diverticulitis with a ruptured cyst, discharged with amoxicillin and metronidazole. What to eat? What probiotics to take? Well, it's hard to answer that without knowing if that, did the hospital give you any restrictions after the surgery, after the diverticulitis, where they were like a low residue diet? I don't know if they gave you any specific instruction. So follow whatever that is, you need to follow it. That being said, I would look to more of kind of a liquid or purified diet for a few days. And when I say purified, I mean pureed, not purified. So if you're eating like whole foods like meats and vegetables, like blend them up, puree them really, really well, make it easy to digest, but get the nutrition in you. Obviously, if you're celiac, be grain-free. And then as far as probiotics, if you're on that combo, I would be on Ultrabiotic Defense. It's a higher dose probiotic that you take. And ideally, you're on it with your antibiotic, not at the same time. Don't take your antibiotic and chase it with the probiotic. Give a couple hours between the two, but stay on it for ideally 3 to 4 weeks after you're done with the antibiotic dosing, so that you can support that microbiome through the course of after completing the antibiotic. But those are places I would start. Yeah, so going back to the 19-year-old with skin problems with Skyrizi, if he's on isoretinoin, that could be causing his back problems and his swollen glands, just FYI. Like that, of all the drugs for acne, I don't recommend that drug. It's a strong potential to create problems. Oh, I see. It was induced by isoretinoin. No, and I'm sorry, I misread your commentary. Yeah, I mean, I don't know. I don't know how to answer you, because if he's had complications from isoretinoin poisoning, and now the doctor wants to shut off his immune system after inducing an autoimmune condition with a medication, that's all bad ideas to me. I mean, fundamentally, he's 19, so he's an adult. He gets to make his own decisions. But if he were my son, I'd do my best to try to get him into a functional care. If he were willing to do it, that's the question mark. Difference between the different vitamin K2s. So the whole K2 family are what are called monaquinones. There's not a lot of great differentiating science between them. There are clinical observations and preferences, we'll say, but not any great research that says MK4 versus MK7 for X, Y, or Z. So there's not a best, honestly. Not that we know of. I mean, that may change, but not at this point. My mom has acid reflux when she lies down at night and sometimes takes a nap in the daytime. Are there any nutritional deficiencies I should look for? Reflux is probably got more to do with either something she's doing or eating that's aggravating, or low stomach acid. So I might consider using ultra acid for a few days and see if that reduces the reflux, because a lot of times it's not reflux, it's low stomach acid, and undigested food can create what feels like reflux. This is the bigger problem, as opposed to too much acid. The other thing you could do is she might have a hernia, a hiatal hernia, and a good chiropractor could assess that and even in some cases adjust a hiatal hernia and get that reflex-like symptom to go away. So I would look at both of those as potentials. That would be first places I'd start. Can you go into depth with deficiencies related to gastroparesis? I mean, I won't today, but I can. I would say probably one of the top would be vitamin B1. Just off the top cuff right now, vitamin B1 deficiency. It's responsible for the neurotransmission of the main chemical that allows for healthy peristalsis of the GI tract. So choline, vitamin B1 would be two really important places to start thinking about helping. Best candidate for supplementing with trace minerals? Are the better food options than supplements? Food is always the choice you should make over supplements 1,000%, provided food is doing the job, provided if you're eating well. This is why I like to test, because if you're eating, I eat well. And there are times where I come back and I'm low in certain minerals or certain vitamins. And in those cases, I'm supplementing myself, even though I eat super clean and eat really, really well. So it's not one necessarily better than the other. It's just sometimes the needs change, and nutrition is not static, it's dynamic. And in that regard, you got to be open to both, the way I see it. What vitamin or mineral deficiency is most related to keratosis pilaris? It's not one. I mean, vitamin A and zinc can be related, but so can omega-3 and vitamin C and biotin. So you just, again, I sound like a broken record. Test, don't guess, folks. Test, don't guess. 63, recently understand I've lived in a moldy apartment for 30 years, moved to a brand new build, VOCs off gassing, and agar plate tested penicillium, mold came up. Gained over 80 pounds without food intake increase. Anything I can do? It sounds like you're mold again. You went from mold to mold. If the plates are testing, I'd get mycotoxin tested, Val, and check your body. I'd also consider, if you don't already have a good, carbon and HEPA filtering the VOCs out of the air in your apartment as well. Like that'll help at least minimize or reduce some of the exposure. I mean, beyond that, spend a lot of time outside, as much as you possibly can. I mean, outside of that, reach out to my office. It sounds like you've got a really complex situation that needs more thought than just a passing Facebook answer. Do you do consultations in other countries? Yeah. If you're in the UK, reach out. We can put up our contact info. Reach out. We consult all over the world. Any idea of a vitamin deficiency that causes skin growths on a cat abdomen? I'm not a vet. I don't even want to speculate. It's just not my forte. Cat physiology, maybe it's similar to human physiology, but I'm not comfortable enough to just speculate incorrectly for you. Diet for diverticulitis. Puree your food for a little while. What's called a low residue diet, if you want to look that up, is just basically it's liquefy your food as much as you possibly can, cook it down, and that prevents That prevents any kind of small food particulate from getting trapped into a diverticuli pouch and creating the potential for irritation or infection. Ultimately, you've got to figure out what caused the diverticulitis in the first place. Most of the time, it's not, people don't need to eat a liquefied or pureed food diet. What they really need to understand is what they're eating that's driving the damage to the intestine that led to the outpouching that then triggered the diverticulitis. So you've got to get that part figured out. Somebody commented, I went to a carnivore diet and completely healed. It's because a carnivore diet is gluten-free diet. It's a grain-free diet. It's a lectin-free diet. It's an oxalate-free diet. A lot of the kind of things that we see can be triggers. Carnivore is not. And so it's a good catch-all, but I don't really recommend long-term carnivore for the rest of your life. There are some nutritional problems that can come with that. How quickly would you expect benfotiamine with magnesium cofactor to reverse lymphedema if B1 deficiencies to cause? Depends on the person and what else they're doing. Healing is not like everybody has this recovery in 2 weeks or 3 weeks or 5 weeks, etc. It's very, very unique to the individual. But I would be looking for changes within the first couple of weeks. Maybe not full healing, but changes nonetheless. Do you think organic sourdough is really as bad as standard bread? No, but I think it still contains gluten. And if you're gluten sensitive, it's a bad idea. Sourdough bread, I think the last scientific measurement of sourdough bread showed that it contained enough gluten to cause gluten reactions in people with gluten sensitivity. So if you're gluten sensitive and you're thinking, I'm going to eat sourdough because it's better, you're mistaken, and you're going to create a glutinous effect in your body that leads to an immune reaction that could, create health issues for you. Okay. I think we did it. We did it for 2 hours. 2 hours, man, that time flew. I'd say thank you so much for tuning in and being with me today. I hope you walked away with some knowledge that you can use and impart in your life or a family member's life that would be helpful and beneficial for them. Remember, our goal and mission here is to save 100 million lives. So we appreciate you hashtagging this video and sharing it. And if you're new to Dr. Osborne Zone, go check us out at glutenfreesociety.org. We've got tons of free information there for you, including an archive of videos and articles that are free to access, that help you navigate autoimmunity and help you navigate it in a natural way without drugs and without main medicine. The guidelines and the blueprints are there. If you sign up at our newsletter, we'll send it to you at no charge because we just want to help you. I want to say thank you again. And those of you who are looking to get better nourishment, we do have a coupon code this week that you can use. It's actually MULTI, MULTI 15. I think that's up in the feed. But MULTI 15, if you're looking for a good, high quality, high potency multivitamin, multi-mineral supplement, you can use our Ultra Nutrients. Type in MULTI 15 and you'll save 15% off through Monday. So if you're in the market for that, we appreciate your patronage. It's how we can do our show every week without a bunch of ads and advertising. But it's also what allows me to come back week after week and give you guys more insight. So thanks for your patronage. Hope you have a fantastic weekend, and we will see you on Tuesday for another Dr. Osborne Zone crash course. Take care.